My name is Hugo Verhoeve. I'm Belgian, but I'm working in Germany. I have my main office there, but we are contributing with centers all over the world in the field of reproductive endocrinology and surgery. We started many years ago with microsurgery of the tubes. We started at one of the first with microsurgery laparoscopically, the minimal invasive surgery. We started as one of the first with in vitro fertilization in Europe. I was trained by Bob Edwards and Patrick Steptoe and all the other leaders in the field of in vitro fertilization. So the last, let's say 20 years, we didn't change that much the treatment of our patients. The techniques and the instruments were increased or were getting better. The problem is, however, principally we were doing always the same. Harm to the patients, pain to the patients, and we were always trying to reduce that, but we couldn't eliminate completely the discomfort because surgery is surgery. So when I heard a few, let's say 2 years ago, about the possibility of, in my specialty, myomas and adenomyosis, that is endometriosis of the uterine wall, I heard about the possibility of doing a completely non-invasive removal or reduction of those myomas and the adenomyosis by using the so-called HIFU technique. We were of course very interested in no pain, payable, the treatment must be affordable for the patients, and of course minimal invasive, no scars, because all over the world women like everything with exception scars. So from the beginning on I was quite interested in this technique, and I tried to be in contact with the people who offered this technique, and HIFU here in Chongqing is certainly the leading center in the world in this field. I'm going to be one of the people who is going to introduce this technique mainly in Europe, where it's still underdeveloped, I think. It's not like in China and in Asia. In Europe it's still quite at the beginning of the history, but I'm sure we see each other back in 3-4 years, then we'll have much more centers in Europe, I think. I think if I heard what's going on here in China and in the rest of Asia, especially of course in Taiwan, in Singapore, we are far behind them. And this has not to do that much with that nobody in Europe or in the United States is interested in this technique. But I think here the technique was started and the development was much quicker, and the engagement of many clinics. I heard there are now 120 or 140 machines only in China. That is 10 times more as in the rest of the world. So my mission is of course very simple. It's my mission to go all over Europe, especially to meetings, and to inform not the VIPs, but the normal doctors, the normal gynecologists, the normal patients about the possibility of this technique. So we need to go into multimedia, we need to be present everywhere, that the patient said, doctor, I read in the internet that there is a technique that will not harm me at all. Can I have that, and where? So that is going to be our mission, to inform, number one, and to offer the possibility to, to treat those patients with the technique that we just described.